For choosing Mercy Gilbert Medical Center for your upcoming surgical procedure. We were built on more than a foundation of bricks and mortar. Our philosophy of radical, loving care for our patients and each other is woven throughout the Mercy Gilbert Medical Center. The golden thread of compassionate care is a symbol of balance between the latest scientific advancements and our mission to heal the body, mind, and spirit. As a healing hospital, we understand the key role your family, friends, and loved ones play in your recuperation after surgery. Continuing with its exceptional level of care, Mercy Gilbert Medical Center is a leader in surgical procedures with its state-of-the-art facilities and dedicated team of surgeons and staff. If you have not already received a call from our pre-admissions team, you can expect to hear from them 1 to 7 days prior to your procedure. At that time, they will ask medical history questions important to your procedure. They will also provide you with important instructions to help you prepare for your surgery. When you arrive at the hospital for your scheduled surgery, you will be coming to our surgery admitting desk on the second floor of the hospital, located in the surgery waiting room. This desk is open from 5 a.m. until approximately 2:30 p.m. each day. If you arrive after the surgery admitting desk is closed, please report to our outpatient services desk located on the first floor, just inside the outpatient services entrance. The main entrance to the hospital is open from 7 a.m. until 8 p.m. daily. If you are scheduled for an early morning surgery and arrive prior to 5 a.m., you will need to enter through the emergency department entrance. Staff members are available to assist you with a wheelchair or escort if needed. During the registration process, you will receive an identification armband for your safety. After your registration process is completed, you will be escorted by a member of our team or volunteer to our pre-op department. Your family will be shown to our surgery waiting area where they can stay throughout your procedure. Our patient tracking system will keep them updated on your progress, and they will know where you are every step of the way. Patients can be identified through their assigned patient identification number, which will be written down on a card for your family. The tracking system refreshes every minute and shows if you are in pre-op, surgery, or the post-anesthesia care unit. Upon arrival to our pre-op department, you will be provided with a bag for your belongings and asked to change into a patient gown. Warm blankets are offered for your comfort. Your pre-op nurse will initially be meeting with you to go over the appropriate forms for your surgery. Although specific questions pertaining to your surgery itself will need to be directed to your surgeon, our staff will help to answer any other questions you may have. They will also have you review and sign a consent for surgery form for your specific procedure, as well as other paperwork necessary for the operation. For your safety, you will be asked to describe in detail to your nurse the type of procedure you are undergoing. An IV will also be started for use throughout your surgery and stay with us here at Mercy Gilbert Medical Center. The purpose of the IV is to deliver hydrating fluids to your body and deliver medications needed before and after surgery. If you have any medical conditions affecting the placement of your IV, please let our staff know. During your stay in the pre-op area, your anesthesiologist and your surgeon will be stopping by to meet with you. Again, for your safety, you may be asked to describe the surgical procedure that you are about to undergo. They will ensure that all of your questions have been answered and verify the consents have been signed. Once you have completed all of your pre-op items, your family will be allowed to come back and stay with you prior to your procedure. Space is limited and not all family may be able to come back at the same time. Minor children must always have one parent or guardian with them in the pre-op area. When it is time for your procedure to begin, your operating room nurse will escort you to the operating room. Medication will be given by the operating room nurse that will start to make you sleepy and relaxed. Upon your arrival to the operating room, you will be prepped and readied for your surgeon. Depending on the type and location of your surgery, it may be necessary to clip some of your hair in the area surrounding the incision site. Additionally, an antiseptic cleansing solution will be used to ensure the area is sterile. Upon completion of your procedure, your surgeon will discuss the procedure with your waiting family members. When your procedure is completed, you will then be taken to our post-anesthesia care unit. Here, your monitoring will continue very closely as the effects of the anesthesia begins to wear off. Specially trained nurses in this area will closely monitor your vital signs as well as ensure that your pain and any nausea concerns are addressed. Please inform the staff if you are feeling a great deal of pain or nausea. Medications available to help with these common discomforts offer many patients great relief. If your surgeon and physician feel that you will continue to need closer monitoring for a period of time, you may be taken to one of our other patient care units or possibly admitted to the hospital. Once the anesthesia has worn off to a comfortable level and your vital signs are stable, you will be prepared for discharge. During this time, your family will be allowed to visit with you. Space is limited, so not all family members may be able to come back at the same time. A registered nurse will review with you and your designated at-home caregiver directions regarding pain management, wound care, prescriptions for medications that may be ordered by your physician, or any other special instruction for your recovery. We will make sure all of your questions are answered before you leave. The staff at Mercy Gilbert Medical Center follows procedures designed to keep you safe while you are in our care. If at any time you have questions or concerns, please speak up and notify us immediately. Mercy Gilbert Medical Center is committed to ensuring you experience the highest level of patient care possible. Our healing hospital philosophy and environment is at the center of the compassionate care you will receive here. We know that patients have choices in where they have their surgery, and we hope you will be confident that you made the right choice by choosing Mercy Gilbert Medical Center. If at any time you are not feeling completely safe and comfortable, please ask to speak with a charge nurse or a director immediately. Thank you for allowing us to have this sacred encounter with you and your family, and we look forward to helping you on the road to recovery.